faster, and the person to become healthy again.
You should also exercise regularly. Try to sleep at least 8 hours a night. Rest when you're tired, and try to minimize stress and anxiety. If you smoke, you should stop smoking if you test HIV positive. Smoking damages the lungs and other parts of the body and increases the body's vulnerability to infections. It's a good idea to avoid unnecessary medication. They can have unpleasant side effects and can interfere with good nutrition. If you're on other medications not related to HIV, you should discuss this with your physician. The emotional and spiritual needs of persons living with HIV and AIDS can never be more acute. HIV positive individuals are living longer. Because they are living longer, they have to deal with longer term stresses. Increasing numbers of family members and significant others are choosing to care for the infected individual, and they also need emotional and spiritual support. There may be lifestyle issues that need to be discussed at a future time, but our initial reaction needs to be compassion, not questioning. Spending time blaming people with HIV positive for their illness distracts from the most important issues. The truth is that we have all done things in our life that involved risk. For the most part, we have been spared the consequences of those acts. We are hypocritical when we blame others and assume they suffer the consequences of their acts. The blame game prevents us from giving beneficial care to those who need it. Judgment can only be given by our Creator, not us. Fear leads some religious groups to reject people infected or affected by HIV and AIDS. They may refuse to visit or care for them. You must confront your fears with facts. Put judgmentalism and prejudice behind you and get on with the privilege and obligation that your religion prescribes. We must keep the trust people place in us. Disclosing one's HIV status is often a difficult decision. It means becoming vulnerable and trusting another with a secret. Care providers are not free to tell others secrets entrusted to them. They should not tell spouses, religious groups, pastors, imams, or friends. If we break confidentiality, we may hurt the one who trusted us so much that he or she never reaches out for help again. One of the tragedies of HIV is that many people are reluctant to touch someone who is HIV positive. Some of this hesitation is due to irrational fears about contracting HIV through casual contact. Others hesitate because they do not accept the HIV positive person or the lifestyle they are believed to have. Whatever the reason, refusing to touch someone who wants to be touched sends the message that we are not emotionally present for the person or that we do not accept the person. We must also be sensitive to times when a person does not want to be touched for any reason or cannot be touched because of a physical condition. Our willingness to touch shows our willingness to care. The ultimate determinant of your health is you. If you are already on antiretroviral therapy, ART, you must strictly use your prescribed drugs and not give the virus chance to make more copies of itself or become resistant. If this happens, your current drug may no longer work and your doctor may need to place you on a whole new antiretroviral drug combination to use. This is why adherence, taking your medications the right way, is very important for getting the best out of the available HIV drugs. Dr. Dan speaks.
A lot of people, no matter how well you counsel them, will feel after some time that this is too much. How can we be taking drugs for life? And because of that, they fall prey to certain people who are claiming to cure them, either through prayers or through miracles or through some herbal remedies and so on. So this is a major challenge from our experience here. This is a major challenge. Patients adhere well if they have been counseled well and they accept what they have learned from counseling. So counseling is a continuous process. It has to be a continuous process. It has to be an ongoing process, and also approached from multiple points.
In all, let's do a recap of the do's and don'ts of living positively. It will, at a glance, help immensely in making you live the life of your dreams. Get informed about HIV and AIDS. Follow a balanced diet with plenty of fruit, vegetables, and whole grains. Eat a diet high in immune-boosting nutrients and antioxidants. Avoid caffeine, junk foods, alcohol, smoking, and drugs. Join a support group. Research has shown that appropriate support combined with a positive attitude can raise CD4 cell counts, that is, the body soldiers that help fight the virus, reduce symptoms, and possibly long lifespan. Treat opportunistic infections including TB and others. Supportive relationships with those who accept and understand the situation are important. Many people living with HIV say they find a new sense of meaning and purpose in life. Connectedness, a network of friends and family, a readiness to find emotional support and to give and receive love seems to encourage good health. Massage therapy can relieve emotional stress, enhance body image and self-esteem, as well as improve circulation, lymph drainage, and muscle relaxation. Get sufficient rest and sleep. Don't share needles. Insist on good infection control from your dentist, barber, hairdresser, manicurist, and so on. If you are pregnant, take steps with your doctor to prevent the transmission to your baby. Keep pets if you are a pet lover, but refrain from cleaning cat litter boxes, bird cages, dog litter, and fish tanks, or use rubber gloves. Find a stress management technique that works for you. Get regular exercise, preferably with other people. Spiritual awareness and active community involvement benefit health. Music, art, and dance can help touch the emotions directly, intuitively, when talking about feelings is difficult. Learn to communicate well. Others will respond better to you. Your self-esteem will rise, your relationships will improve, and you can prevent stress. Sometimes behaving in a confident manner generates real confidence. If you hide your anxieties and act with self-assurance, people often respond by listening and assuming you know what you are talking about, which in turn reinforces your confident behavior. Take an HIV holiday when you don't think or talk about it.